Awesome.
Where were you born?
Africa.
Where in Africa?
It's a big place. What country?
What country?
Yeah. Remember?
Ethiopia.
There you go.
Abaynah, the main reason he was given up for adoption was his biological mother lived in extreme poverty. His biological father died of malaria when she was pregnant with him. And she managed to keep him until she managed to live sort of on the fringes of society, because what happens is a woman without a partner, without a spouse, is probably the lowest rung of the ladder in terms of social status. And her husband died when she was very newly pregnant, and it sounds like someone cast doubt on the parentage, on who the father of her child was, and that kind of made her into a sort of social outcast. And so she was unable to work and to function in the community the way she had, and she moved from relative to relative, living off of charity, trying to grow some vegetables to sell in the market. And she told us through translators that by relinquishing him, she and her daughter would be able to function again. She would be able to work. She would be accepted again back into society, because she wouldn't be tainted with this idea of having had a child out of wedlock, and which wasn't even true. But anyhow, it was a sad story, but it wasn't uncommon. And a lot of the children in the orphanage, some of them had one parent still living, some of them had neither parent living, and it wasn't just illnesses like HIV that people typically think of. It was very easily preventable, curable illnesses like malaria and hepatitis A, and things that with the proper health care could have kept these people alive so they could raise their kids.
There are a number of conditions and diseases in Ethiopia that are actually very treatable. They might include things like malaria. There might be diarrheal diseases and conditions because of the impure water. There are certainly respiratory illnesses such as pneumonia, simple colds, those kinds of things that are also very treatable with proper conditions. Services are in great demand. Unfortunately, the resources available really dictate the amount of service we can provide and the number of patients that they can see in a given day. The generosity of donors, we intend to continue to provide more service through our community health initiatives and ultimately through the opening of additional clinics throughout the country.